Recently took a trip to Mexico, and they were eating a lot of food and they weren't careful. Could there be something in that history that would bother you a little bit?
Well, that type of a history is suggestive that the child might have picked up some sort of an infection when the child was in a different environment. The most common infection that one would get in Mexican travel, as well as most of the Caribbean and part of Latin America, is what's referred to as traveler's diarrhea. And there's not necessarily a specific bacteria that's necessary to eradicate. However, the introduction of certain foods, especially water that's not been purified, can cause a change in the normal bacteria that live in the colon, and as a consequence there can be abdominal pain, and usually, or almost always, associated with diarrhea. However, if the pain is especially localized to the right side of the upper abdomen, then one has to think about the possibility of not only a parasite, but that parasite is also affecting the liver.
What's the most common parasite you would be thinking about?
In this particular setting, the most common parasite would be entamoeba, and that we know is, there are reports of children and adults getting it in New York, but most probably those are getting it from a worker or a food preparer who has it and has not used the perfect technique, but it's certainly very widespread. In fact, a lot of these parasites are so common that in large regions of the world, there's more people who have it than don't have it.
How do you make that diagnosis if you had a kid that came to you?
The first step in trying to make that diagnosis would be to look in the stool to see if there are the actual parasite itself or the egg or the ova of the parasite.
Is one stool valuation enough?
Usually, sometimes if you're lucky, and more than half the time that will be, but usually what we recommend is that the child have at least 3 specimens submitted, and a very important part of the process of getting the most information as possible with the least work for the parent is to space the specimens apart within 48 hours, because there's some types of bugs which have cyclic shedding, and so if you get 3 specimens all from diarrhea on Monday, it's not nearly as valuable as going Monday, Wednesday, and Friday.
All labs are capable of doing these tests accurately, or are there some labs better than others?
Certainly some laboratories are better than others, but for the vast majority, if you go to a standard laboratory, if they don't have the ability to do it in-house, for instance, let's say with a Clostridia difficile toxin, a bacterial infection that's toxin-mediated, that's causing more and more serious problems in older people, and I believe also we're seeing it more in kids, they'll send it out. So any reliable laboratory should be able to do these.
If our friends from the South, like in Mexico or the Caribbean, came to New York City, do they worry about the reverse of traveler's diarrhea? Could they get it from us?
Not normally, because they've been exposed to such a large variety of microorganisms in their environment that the ones that they're going to encounter here, they've probably seen, and they're not going to be bothered much by them.
If you happen to be in Mexico and you were getting a lot of loose stools, what would be the best advice you'd give to them so they could probably manage the trip with the least amount of discomfort?
Well, the best idea would be to try to kill some of those bacteria that you've probably become exposed to, and medications such as Bactrim, as long as they don't have a sulfa allergy, or Cipro would be perfectly adequate to give. And in youngsters who are at risk for having more severe consequences, who are going to these areas, I'll often advise that they take some with them. Another method that can be used, which is not foolproof, but can provide a little bit of protection, is the ingestion of probiotics prior to going, because those are products that provide bacteria to your body that will live in your colon, and so if you do have a exposure to new ones, they'll be competing with the probiotics, and that should lessen